We're going live.
Okay.
A very pleasant good afternoon to all of our viewers. We want to welcome you to our Let's Talk for this afternoon. To all of our viewers, we want to welcome you to our Let's Talk. We are delighted that you have taken the time to be with us this afternoon. And we do have a very interesting topic that we're going to be discussing. You know, yesterday on the world news, on the various cable stations across North America, the big news was the reversal of the Roe versus Wade, meaning effectively that abortion is no longer a constitutional right for women across the United States of America. We have been discussing abortion for a little while now, and today we have our final session. We're talking about abortion, and I may say, and other things, other matters related to. We have with us this afternoon two very special guests, individuals who are no stranger to us, no strangers to us, both medical personnel to guide in our discussion for this afternoon. But before we introduce them, we invite you to have a word of prayer with us, shall we? Eternal Father, be with us as we go into this afternoon's presentation. Guide us and take full control, and grant that all of our viewers will be edified as a result of this discussion. In Jesus' name, amen. Well, before I introduce our guests, I do want to make an announcement. Just a note to our viewers, those of you who are viewing on YouTube channel, whether you're viewing on SLC Adventist or SLC Church channel, we have been having some challenges with some interruptions. A few individuals have been posting unwanted material on the chat. That has forced us to restrict the chat to subscribers. We are asking, if you have not yet subscribed to whichever of the two YouTube channels you're watching, SLC Church channel or SLC Adventist, please hit that subscribe button now and allow yourself to be able to talk freely in our chats. Thanks for your understanding. We have been having some very unfortunate communication in our chat, and we are forced to make that adjustment. So you want to be able to chat, to post your questions. You can subscribe. It doesn't cost you anything. All you have to do is to hit that subscribe button, and you know you're good to go. So please do that for us. Thank you so much. With us this afternoon, we have Dr. Monica Stevens. She was with us last week, and she's back again. Dr. Stevens, good afternoon and welcome to Let's Talk.
Good afternoon, Dr. Greene, and good afternoon, Dr. Henry, and the rest of our listeners. I'm looking forward to having a wonderful and...
Thank you so much. And we have with us Dr. Avenel Henry. Dr. Henry.
Discussion this afternoon. Thanks for having me again.
Okay, Dr. Henry, we are delighted to have you with us. Thank you for coming back. We missed you last week, but we do understand. We do understand the circumstances. It's a delight to have you with us this afternoon. Good afternoon.
Hi, good afternoon, Dr. Greene. It's always great to be here. Missed you guys as well last week, but it's great to be here. I look forward to this afternoon.
All right, wonderful, wonderful. Now we are going to be talking this afternoon about a few matters related to abortion. You know, we have been having this discussion for a little while, and we are wrapping things up this afternoon. So we're going to try to move quickly, but at the same time, we want to make sure that we do not in any way disenfranchise our listeners. You have your questions, please feel free to post them. Of course, as I indicated just now, you have to subscribe. Let's jump right in with this. A natural pregnancy is expected to last for 9 months. I know some women have a difficult time keeping their babies, maintaining the pregnancy, that is. What are some of the factors? And perhaps Dr. Henry, you as the gynecologist, maybe you can respond to this first round. What are some of the factors that impact a woman's ability to maintain a pregnancy?
So that's a good question. Actually, if we talk about the reasons that a pregnancy is maintained or carried to term, which is what term means, the full 9 months of pregnancy, you can think of the characteristics of the pregnancy itself, like the egg and the sperm, and then you can think of the characteristics of the environment that the pregnancy is in, as in the woman's body, and then you think of the large environment around her. And with those 3 big classes, we can think of actually hundreds of reasons why, and we can just go through some quick examples. So if you think about the egg and the sperm itself, or the pregnancy itself, women who have a lot of different genetic reasons, like cells or chromosomes that aren't quite equipped, or that are missing some pieces or didn't really join fully together correctly, that's actually the #1 cause of spontaneous miscarriage, like just something that happens with the genetics and with the cells, and it just never quite form together, right? And then if you zone out from the cells to the next level, if you think of the immediate environment. So for a pregnancy to implant, or what we call connect into the cells and then grow, and then all the structures around it have to grow and maintain, and the cervix or the bottom of the uterus has to stay closed. At any of those levels, different diseases like chronic diseases like diabetes, hypertension, these things we know, different autoimmune diseases or things we may have heard of like lupus, or these things that we hear about, any chronic disease you have that can influence that. Different health conditions or trauma, like people who get in really bad motor vehicle accidents or have strokes, or just any type of health problem that you think of, can affect that ability of that environment to be maintained. And then when you zone out from that into the large environment of the woman's entire body, anything that affects your nutrition or your overall health status, or just your ability to have a safe environment to be in, like physical and emotional abuse and all of these things. And then the large environment, like a community that has pollutants in the atmosphere, or not a safe place for you to be able to sleep and to rest and to grow. So any of those factors on any of those levels can affect the ability of a pregnancy to go from conception all the way to term.
Okay, pretty comprehensive there. I trust that our viewers followed you. So there are a number of issues why a woman may not be able to carry pregnancy full term. Sometimes the body naturally ends the pregnancy. I think I heard you say that, various things can cause that to happen. Now, we I suppose would want to refer to those as natural abortions. I don't know if I'm using that term correctly, where the pregnancy, the termination of the pregnancy is not caused by external factors, but it happens naturally. So I'm going to use that term, a natural abortion. Now, in the case of a forced abortion, the body is conditioned to end the pregnancy by outside influences. A lady gets pregnant, she doesn't want to keep the baby, and she does something. And that could be a number of factors. She could maybe take some kind of tablet, some kind of medication, or whatever. My question is, what is involved here? And can this have long-term effects on the mother? So when an individual decides, I don't want to get pregnant, sorry, I said that wrong. I don't want to be pregnant. They're already pregnant, but they don't want to maintain the baby, the pregnancy, and they decide to terminate it. So they're getting outside help to end this. What is involved, and how does this work?
So that's a good question. So first, the term, in terms of when we think of the body naturally ending a pregnancy, we call it a spontaneous abortion, And then even within spontaneous abortion, there's so many different types. Like when the body is at different stages of ending the pregnancy, each of those has a different name. So you're okay if you're not sure exactly what the words are that we see on the news, but in general, spontaneous abortion is something happens within the body and not externally. In terms of the effects or long-term effects of a woman deciding to terminate a pregnancy, or you are already pregnant, like you said, and you're deciding that you don't want to be pregnant anymore, it depends on a couple of things. One, it depends on how pregnant you are. Let's say if somebody is 1 week, 2 weeks, 3 weeks pregnant, it's different from if they're 12 weeks, 13, 14, 18 weeks pregnant. And in terms of the options, like you mentioned, long-term effects depends on how pregnant you are. So in the very, very early stages of pregnancy, a woman can choose, like you mentioned, to take different types of medications that will end the pregnancy, or they can do procedures like we've probably heard of something called a DNC, or a dilation and curettage, or essentially like a suction type procedure, if you think about it that way, to empty out the contents of a uterus or to remove a pregnancy. And if you are very, very early on, it's actually interesting enough, not a lot of data that we have that shows that there's any long-term effects of medication, like the medications that you use to terminate a pregnancy on a woman, like her future fertility, etc., is actually not affected by those pills. However, if you terminate a pregnancy, or you're pregnant and you no longer wish to be pregnant, and you do that by a procedure, with having multiple of those procedures, there are some theoretical risks to future pregnancies, not really inherently because of having had an abortion, but mostly because of the complications of surgery in general. So if you think about it, your uterus that's holding the pregnancy, there's a lining inside of it that the pregnancy is located on. And if you've had multiple surgical procedures that have had to remove, and this doesn't even only go for abortions, but any type of surgery you've had inside that lining, when you are pregnant in the future, there is a risk that there can be some difficulties with your placenta, or the thing that supports the baby and gives it the blood vessels and gives it the nutrition, being abnormal in the way that it can stick to that lining. But that data, it's not 100%. It's not like a straight line of relation. And it's not to say, okay, if you've had one DNC or 2 or 3 or 10, this is what will happen to you. But usually when I see patients in clinic and when we're talking about procedures, long-term, having multiple procedures inside of the uterus and any type of procedure, there's a theoretical risk that it increases the chance for that placenta to be abnormal.
Let me I'm going to come to Dr. Stevens in a minute, but you know, I know that the decision yesterday by the Supreme Court means that in some states, I know, for example, in Missouri, I think it is, right after the announcement was made, the governor or whoever signed the document to make abortion illegal right away in that state. So I know that there was before this a certain degree of freedom for women to go and have an abortion legally. With the removal of that, now people, I'm guessing, may resort to some illegal means of abortion, which can make it a little more difficult. And maybe I should slip to Dr. Stevens now, because Dr. Stevens, you know, in a Caribbean context, my understanding is that in most of these islands, abortion is illegal down here. So people have been using the backdoor method kind of thing. How dangerous is it? I don't know if in your medical practice you have come across any such thing, or at least I've heard of them, but how dangerous is this for ladies?
Dr. Greene, thanks for that question. It's a very important question, and you're so right in terms of that decision that was made yesterday. That is definitely one of the setbacks or the disadvantage we're going to see, because when a person had the liberty or the freedom to go and have a safe abortion, now if they're desperate and they mean that they want to have an abortion, they are going to have an unsafe abortion. And when that happens, it puts mother at severe risk. We don't see it as much as we did in the past. Before, we would have lots of mothers coming in very septic because they have had infection in the womb because they went to someone who performed an abortion that was not sanitary, and they develop infections and they put themselves at risk. Some of them came in with severe bleeding, weak and thready pulse because they had a generalized infection from that procedure. I have known a few cases which persons have actually died, just about 2 since I was here. And that was the reason, because of an unsafe abortion. So that's definitely something that will happen, because persons will be determined that they're still going to have an abortion and they will do it in an unsafe place.
Now, we're not in any way suggesting that we are taking sides for or against the decision.
Not at all.
But there are implications one way or the other. The interesting thing about this decision, as I understand it, is that in some cases, abortion will be banned outright, irrespective of the cause of pregnancy. So that a woman is raped, she can't have an abortion. And we spent a lot of time talking about those kinds of matters in the past. But this is where I think the discussion becomes so significant, so important, because if a doctor determines that, hey, it is not safe for this person to carry this child, then in that particular situation, the doctor means, therefore, that the doctor would not be able to go ahead and end the pregnancy. And I think that is pretty interesting.
That's going to be a really sticky area to maneuver, because the world abortionists, the world abortion law, if there are 2 things that they always gave, you can have an abortion to, and that was rape and incest. Some countries would argue that for incest, you have to seek permission, whereas for the rape, it's just an automatic, you are allowed, so to speak, to have an abortion if you're raped. But it always goes back to the mental health of the person as well. And this is where, when a physician sits down with that person after a rape and invites all key personnel involved to have that discussion, the mental health of the patient is going to be key in whether or not she's going to carry the pregnancy, because that's something that she has to relive over and over and over again once she decides to have that child.
Well, let me move on a little bit, because time does move quickly. We are discussing abortion and related issues, but I think it is important for us to talk about some other factors. Just now, I did ask about if external things can impact abortion. Some people drink things, take things. And on our first program, I spoke about a bush that, as a little school child, they used to call 666 because of what it does. So now that leads me to other factors, the matter of nutrition on the baby. How important this is. I'm really asking 2 questions. How can what we eat impact the baby, and maybe your ability to keep it? And then what kind of emotional and physical maturity does one need to have a healthy pregnancy? Dr. Henry, as a gynecologist, I understand you to deal with pregnancy and the development of the baby, etc. How do you counsel pregnant mothers with respect to what they eat and what they shouldn't eat and the like?
So it's actually interesting. A lot of the concepts that we talk about in prenatal care with our patients, a lot of the general concepts that we already know about health, it doesn't necessarily change as much during pregnancy. It's when a patient comes in for the very first time and says, she's pregnant and we're beginning her care, I actually go all the way back to basics. You drink enough water, you get enough sleep, you balance a meal with fruits and vegetables. There are a couple of things that people that are like especially dangerous in pregnancies, like different types of soft cheeses or these sorts of things. We can go into the nitty-gritty of those things. But in general, when you think of this is a way to be healthy, I need to exercise, I need to have moderate physical activity, about 3 hours or so a week. I need to be able to drink enough water, I need to get enough sleep. Those are the things that help your body to remain healthy, and having your overall health controlled is actually what goes a long way to influencing the pregnancy. Now, in terms of when we talk about losing a pregnancy, one of the things that I often tell patients, because I've seen a large amount of women go through miscarriages, and there's one important thing, and to any listeners out there, it's actually not based on, okay, I didn't drink enough water, I didn't get enough sleep, and that's why I lost my baby. There's actually not a direct correlation like that at all. And like I mentioned in the beginning, it's because we live in a fallen world and these tragedies happen. And the overwhelming majority of times when a pregnancy is lost, it's something that the woman actually could not control. That's why we say it's a miracle every time, someone gets all the way to full term and has a healthy pregnancy. It really is about, just this miracle of life. But for someone who is pregnant or who is looking to become pregnant even, or is thinking about that in the future, the best thing is to get your overall health under control. So you're eating a balanced diet with fruits and vegetables. You are maintaining moderate activity to kind of keep your heart and your blood flowing correctly and keep the levels of excess sugars and stored, heavy fats out of your diet. These are the general health principles that lead to a good pregnancy.
Let me just stitch this in here. What about preparation? So should a lady start paying attention to these things when she discovers she's pregnant, or should she, realize, hey, I'm planning on getting pregnant, I better take care of how I take care of myself? Is there a difference?
Yeah, so that's a great question, and it's a personal passion of mine. I love preconception, family planning, and like, this is me. I'm thinking about becoming pregnant. What can I do? It is honestly such a beautiful time to intervene in a woman's health and to decrease her overall risk of the pregnancy. So if you're thinking, let's say you are in your marriage, you're considering, okay, we are looking to become pregnant, that is actually the time for you to become as healthy as you can be and build those habits up, because there's so many changes that your body goes throughout the 9 months, that sometimes it becomes hard. So people talk about cravings and this and that and the other, and sometimes it's difficult to be as disciplined, but starting before that point is actually the perfect time to get great habits and to get into the habit of just caring for your body the way that God has instructed us to.
I think that the interesting thing here is that a lot of people who are pregnant didn't plan to be pregnant.
That's right.
I was looking at the census some time ago, and I'm sorry I didn't think about this before. I would have gone back to check to see the trends. But back then, a few years, maybe 5-6 years ago, when I did this research, I was alarmed at the number of teenagers who become pregnant in the Caribbean. So, Dr. Stephens, let me ask you this question. Not that Dr. Henry can comment on it, but I kind of want to put a spin on this one. I believe a lot of the unwanted pregnancies we have today is because many persons seem not to be able to exercise the discipline to resist the temptation to control their sexual appetites. Can you talk us through puberty, especially as it relates to girls? And for both of you, does the onset of the physiological changes in the body necessarily mean that it's time for sexual engagement?
Okay. Dr. Greene, yes, another very good and important question for discussion this afternoon. When we're talking about puberty, we have to talk about Tanner stages, right? The Tanner stages of puberty, and there are 4 stages, starting from age 8, that's stage 1, where it's thought that that's when a girl really starts going through puberty. However, there are not a lot of effects that is seen. In stage 2, between 9 and 11 years old, that's when you see, in the female, you see breast buds start developing, they start having pubic hair. And during this time, Pastor Greene, is where socialists and psychologists believe that this is when the sexual desires of a female child starts to show. Then stage 3, after 12 years old, they start getting axillary hair, the breast starts developing more, the pubic hair becomes more. And then in stage 12, stage 13, stage 4, when they're 13 years old, that's when most of the time they would have their menses. But we do know, because of a lot of the dietary changes today, a lot of young girls start having their menses pretty early on. And based on the Tanner stages, you can see if between 8 and 11 years old, a female child is starting to think about sex. You can see how much work we have to do and how much we have not done. Too many times, sexual education is not discussed anymore at school or even at home. And parents have a hard time discussing that with their children, especially as Christians. But it is not archaic. We still need to talk to our children that saving themselves for marriage is the right thing to do. But they have all these urges, and what do they do with them? If we don't talk to them, they're going to talk to outsiders, and they're going to talk to people who tell them that it's okay to express themselves. And that is why we have to talk to our children about the feelings that they're having, those desires, and how to put them in the right place.
Now, as you spoke there, my mind went back to an experience I encountered as a child. I had a niece living with me, or with us rather. My mother had gone to work. We were children. We were by a neighbor, and I believe my niece, who was just about maybe 2 years younger than I am, started experiencing her menstrual flow, and as the responsible adult, she went to my neighbor, who was like a very good family friend, but this was an older lady, and I heard her saying, "Oh, you're seeing your flowers," right? So that's a term she used there. I want to make sure that the public, those who are listening us, understand the terminologies that we're using here. You mentioned, when a girl starts seeing her menses, and but I just want to make sure that everybody understands what we're talking about. I remember doing family life education in a church in Tortola back then. There was an old lady. She was a friend of mine, very dear old lady. She loved me like nobody's business, and except when I was doing family life education and I used the word sex, and she would stand up in the church and she would say, "Never, never, never you use that word in church." Now, of course, we know that it is God invented it, God made it, and he wants us to share appropriately so that people can understand. So I just thought I would push that in, so that everybody understands where we are, what we're talking about. Now, let's go back a little.
Just if I could add something here. Sometimes if you as the parent, if you're not comfortable, you may have a very good friend that the child may trust and may be comfortable talking to. You can encourage that as well, because you would know that you and this individual share the same beliefs and have the same ideologies. And so if you think that the child will not open up to you, it is best to encourage them to talk to someone that they can trust and you can trust also.
I want to think that one of the problems is that sometimes parents wait until it's too late to begin the sexual education talk. I remember having one of the things I do during my family life seminars, I have a presentation called How to Talk to Your Children About Sex. And I was making this particular presentation in a seminar I was doing. And the lady stood up and she asked, she said, I'm going home tonight to talk to my daughter about this. And so I asked her, "How old is your daughter?" And she said, 15. And I said, "Is this the first time you're having a conversation like this with her?" She said, "Yes, Pastor." I said, "Now you have missed the boat a long way, because there's no way she's going to be able to have that conversation with her daughter. Her daughter is not going to listen to her. For one thing, the daughter's already gotten her information elsewhere, etc." But let's go back. again, in as much as time is important here, let's go back. Dr. Henry, you may want, I don't know if you wanted to add something to this in terms of the changes, the dynamics.
Yeah, I think just a brief part to everything that Dr. Stevens so beautifully expressed. I think I just want to put a plug for becoming comfortable with the real words, the real terms, the real body parts, because even now there's so many women that I encounter in labor, in pregnancy. They are 9 months and pushing a baby, and they still do not physically understand what is going on with their bodies. So I just want to put that plug in. First of all, anyone who is a parent to boys or girls, to just encourage the correct use of terminology and correct orientation of your children to their own anatomy, their own body parts, and what it all means. And like Dr. Stevens said, again, it's in the interest of time, but the way that we discuss and introduce our children during puberty, like the very, very early stages, towards their bodies, the changes, the things they're feeling, that is the foundation of how they will go on to understand and express themselves. Because make no mistake, your children will express themselves. But sometimes it will be in dangerous ways, in ways that are inappropriate for them, ways that they probably don't fully understand the ramifications or the long-term effects of. And as parents and as a church community, as people with access to children and who God has instructed to shepherd our lambs, we have like children's ministry leaders, Sabbath school leaders, adventures, Pathfinder Club. All of these ways are amazing resources and opportunities that I think God is going to hold us accountable for if we do not step in and help our children to make the good foundation. Because we're talking about abortion, we're talking about unwanted pregnancy. This is so far down the line, but body autonomy and the way people understand sex and understand pregnancy and understand these things, we can intervene way, way, way before any of this. So that's just my small 2 cents on that.
Okay, thank you so much. Now, I want to pause here to answer a couple of questions that some of our viewers have asked. Somebody's asking, I heard a friend in the medical profession stating that the Caribbean may now become a hotbed for medical tourism to accommodate abortions. Is it a worthwhile risk? That's a question. I am not sure if that is going to be the case. If it's not legal in the Caribbean, why would tourists come to do that? But I'll leave it to you, medical persons, to respond.
Well, unfortunately, I'm not sure exactly of each Caribbean island's legal ramifications in terms of abortion care. I think that, so Roe versus Wade, like you said, it upturned abortion being a constitutional right. There are some states and some areas that have a lot of similar wording or similar laws that will now be enacted, and people that will travel. But the thing is, it's not that right now in the entire United States of America, there is nowhere that somebody can get an abortion. It's just that it is becoming harder and harder and harder, and now impossible and sometimes illegal in their home state. But there are still other states within the United States that they can go to. And if they're unable to, like Dr. Stevens was mentioning, unsafe abortion is what results. I'm not sure we in the Caribbean will initially feel that onslaught, because essentially, in plain words, if they can't travel to another state, how would they be able to then travel to the Caribbean to have these procedures done? Like there are closer places that are available. But I think what our danger is because I think, Dr. Greene, as you mentioned a few weeks ago, America coughs and the Caribbean catches a cold. With us modeling different practices after some of these laws, sometimes out of a good heart, sometimes out of trying to uphold a certain moral standard or trying to go by different things that we believe the Bible to say, sometimes, we may enact harmful constitutional laws.
Okay, thank you so much. Dr. Stevens, yes?
Unfortunately, in our society, we don't, it's sad to say this, but we don't uphold a lot of the laws. And so even with abortion, we know that it's illegal in Antigua. However, we all still know that it's still done, and there are many, many safe places. I shouldn't say many, but many many safe places that one could go and have an abortion. And so I think it's going to be almost like the same thing in the US, even though the law has passed, people are still going to find a way to have it done. So I would not say that they would think that the Caribbean is a safe bet to come and do it, because I'm sure they could get away with it in the US too, because
Okay, I think
doctor who's going to be willing to take the risk to perform the abortions.
here's another question that one of our viewers is asking. Interesting question. Is it only the woman who should see about their health when planning to get pregnant? Shouldn't the man do so too? Now, this is an interesting question, because the woman is the one who carries the baby, not so?
Yes.
How does this work?
You know,
So,
yes, it helps. Okay, look.
well, no,
it's something that I know. Yes.
I get
Overall,
excited.
yes, I'm going to let you get that big part in. But I just want to say that overall health is important in every situation, and even to the men who are contributing to the sperm. Remember, that man is contributing half the chromosomes, and a lifestyle, diet and exercise still has a role in how healthy our bodies are, including even down to our DNA level and what we are exposed to as in our environment. So the man is supposed to keep himself safe and healthy as well, because he does contribute and he does play a part.
Yes, agreed 1,000%. In terms of infertility numbers, a large majority of infertility is what we call male factor infertility.
That's
so there's
correct.
different women who will come and they will get different types of testing. Everything will be negative, but it turns out the sperm, either the sperm count is low, what we call motility, or the ability of the sperm to move, the pH of the fluid that the sperm is in. There's so many different factors that men probably don't think about how their lifestyle is affecting that. It is essential for a man who would like to father a child to see about his own health. I would say you should schedule a visit with your doctor and say, can I have a checkup? Can we run everything down? Because I'm looking to start this process. And that's just the beginning of the process. But then going on into the 9 months of pregnancy, and then what we call the 4th trimester or immediately after, there's so much required of both partners who are going about a pregnancy that your health is essential. If you think about all of the risks and all of the changes that you all are going through together, not being able to be your healthiest self will adversely or harmfully affect you at every stage of that. So it is 100% as important for the support person in a pregnant person's life to be healthy.
Sounds like we're gonna have a let's talk on male health as it relates to pregnancy. We can organize that. Well, let's move on. Last week, Dr. Stevens mentioned the morning after pill and its medical use when a woman reports that she has been raped. Now, some persons have an ethical concern with the morning after pill. Is it something that is readily available over the counter? Can I go to the drugstore tomorrow and buy one and say, I'm going to engage in illicit sex tonight, and the lady's going to take it afterwards and she's going to be fine? How does it work?
So in terms of the morning after pill, we think of a group of medications called emergency contraception. So contraception means preventing pregnancy, right, from happening. So a pregnancy has not yet happened when these medications are taking effect. In terms of how we think or define pregnancy, or when you take a blood test or a urine test that says you're pregnant, what that has reflected is that there's an egg and sperm that have come together and have implanted or have attached to a point in your body, right? So in terms of the morning after pills, and there's different options. We won't really get into all those specifics, but they all act to prevent that connection, either preventing the egg from releasing, or what we call ovulation, or preventing the way that the hormones make that attachment happen, but they all act before an actual pregnancy has occurred or before that actual attachment. So that's how they work. It is, well, again, I will offer this as a personal opinion. It is a very important part of reproductive health to have these things available. Like Dr. Greene was saying, in cases of rape and other horrendous tragedies, these medications are safe and effective to prevent pregnancy. I understand a lot of the terminology and the marketing makes us kind of stop and say, do I have to question my ethics if I support this? Am I saying this pill is a woman going to a drugstore and buying a pill and getting an abortion? It is very, very different. The way that these things act, they don't stop a pregnancy that has already happened. These things aren't to reverse that or something. These things are the things that prevent that from happening, because they act at the point in the cycle before the pregnancy has formed. That's why they're so like time specific.
Let me push you a little more here, because I noticed that you are defining pregnancy as implantation, correct? So when sexual intercourse takes place, the egg is fertilized way up in the fallopian tube, you know, it comes out of the ovary, it's fertilized there. According to your definition, pregnancy has not yet taken place. Am I correct?
Correct.
Okay. For those individuals who claim that conception begins at the fusion of the egg and the sperm, they may argue that, well, that is aborting a child, technically speaking, because fertilization has taken place. How do either of you respond to that?
Well, I would just say no, that's not true. I think that it is interesting because a lot of, I think we mentioned this a little bit when I was on the program a few weeks back, the beginning of life and our regard of life is more a philosophical or religious or a moral standpoint than it is a scientific one. And there's sometimes where we think these worlds collide, but there's also sometimes where, you know, we can follow God's law and what he has said and use the science because God has made science, you know, and there's other ways that we can try to twist and thwart and kind of distort the things God has said using science. And I think that if for someone who says that the way an egg and a sperm combining, that is pregnancy, or that is, you know, life, or that is what has happened, I would then ask them several other follow-up questions, because to have life occur and to be transpired, or the way that we've defined life in literally any other setting, there's more required than that. There's more required than the combination of cellular materials. If I was in a lab and I had an egg and a sperm and I had combined it, that petri dish is now not a pregnant person. That petri dish is not pregnant. That petri dish cannot walk outside and have rights and ask for health care and get insurance because the petri dish is pregnant. Okay, it is until somebody then takes that combination and implants it, and then it grows successfully and it shows signs of sustaining life, that we say a pregnancy has come forward. So like I said, that I think it changes the conversation when we try to use things like egg and sperm means it's a pregnancy, means it's an abortion. I think we are getting into ways that humans are allowed to disagree in terms of philosophy and life, but I think we're trying to use that in a way that the science doesn't 100% guarantee.
Very interesting response. And we don't have the time to pursue that some more. Of course, it is true that, you know, implantation is necessary if the child is going to come along. Because even when we talk about in vitro fertilization, when we deal with, we had a program here, we had a couple of programs here dealing with reproductive technologies, and we know that the development of the baby is an important aspect, but we're going to leave that alone for this afternoon. I want to move on to something else. And again, our time is limited, but let's go to this very important matter here. I once discussed contraceptives on this program, but it seems to me that we do need to talk about it, even if briefly, in light of the topic before us. Some persons clearly do not want to get pregnant and have a baby. Children are very expensive to maintain. I believe it is a sin to bring children into the world and we don't have the ability to adequately take care of them. Now, this is the interesting part. I came across a girl once who was only 21, but she had 6 children. Her grandmother was taking care of the last baby. Why are people afraid to use contraceptives? I know some people think that, well, you know, this is wrong, this is sinful, etc. But like I said, I think it's a tragedy for a person to bring a child into the world and they're not able to take care of them. So why are people afraid to use contraceptives?
Well, if I must start by answering. First of all, Pastor Greene, people are afraid of what they don't know. And I find of all people don't really know. They don't understand. So first of all, they would say, no, I don't want any contraceptives, but they don't understand what they are, how many of them are out there. And then you have the partner. The female might choose or prefer a form of contraception, and the partner don't like that. For example, condoms. Some males would say, no, I don't want the condoms, and the female doesn't want to do the injection, she don't want to do the pill, she doesn't want to do anything else. Sometimes even for religious purposes, there are some persons for religious reasons they don't want to use the contraception because they are thought that it is evil and that we should be fruitful and multiply, and whatever God puts there, it is supposed to be there, and we should not stop that at all. And sometimes persons think that it's inconvenient. I can't be bothered with taking a pill, going to the health store, picking up something, going to the clinic. They think that it's inconvenient. Sometimes they think, I'm not having sex that much, so why should I be putting some things in my body that I don't think that I need? Sometimes it's lack of access. In our setting, that's not the case because we have a lot of clinics that they can go to and get access. But I think overall, when persons do not understand, they do not have the education, they run away from it, they shy away from it, and they don't make proper decision.
Now, of course, just before you, Dr. Henry, I want to just make this reference. I think this is important. You know, I like to discuss contraceptives in the context of a marriage. We promote a certain lifestyle. One of the things I do, for example, when I do premarital counseling is that the couple has to go research the various types of contraceptives that are out there, their effects, etc., because they need to make an informed decision. I remember one time many years ago when my second son was, I believe, 8 or 9 years old. He came in the bedroom one day and he asked his mother, he said, "Mommy, what's a condom?" Now, at 8 years old, I would never have been able to ask my mother a question like that, you know. But my wife responded by saying it's a contraceptive device that parents use when they don't want to get pregnant. And his response was, "Oh, that's why I'm not getting a daughter." So the idea of contraceptives being used is not in any way promoting illicit sexual behavior. You know, we're talking about responsible acts. We're talking about I think who was it that mentioned it last time? Family planning. Go ahead, Dr. Henry. Sorry to interrupt, but I needed to say that.
Oh, no, for sure. And I think that what you're saying is kind of exactly the backbone of what I was going to say. I think we're all having this conversation from the standpoint of, like you said, the correct confines of sex or where sexual expression in that way really belongs. So we're speaking about persons who have committed themselves to God and to each other. And so I think that people take some of the baggage or the ways that they've been spoken to about sex and their sexuality and their bodies and medicine in general into marriage and don't think, essentially. I think that a lot of the time stuff has been so hidden and so taboo and so hush hush underneath the table. We don't even know the words for our body parts. And like we're going into marriage like this. But you mentioned something that I think was actually really, really key: unwanted pregnancy and then not not being able to care for a child, I think we should be speaking about that with as much passion as we talk about abortion, because I feel like it's really heartbreaking to see that what the world knows of Christianity is, how Christians think that, okay, life starts, before birth. They think, when they think about that, all the world hears is Christians don't want women to have a choice to have abortions, but they don't know that what we're actually saying is it is divinely responsible. The way that the community cares for a child has eternal ramifications, and it's deeply serious. And I feel like it's really telling, and it's really heartbreaking that nobody sees that that is actually the biblical principle that they're trying to enact. Like what we should be championing is how important it is for us as a community and for you as a family to think long and hard and be prepared to care for a child. Because that's what the Bible is talking about, but we think, and somehow we kind of have lost our way, I think, in that we don't know how to talk about things. We don't know the information. And this is just a small plug for contraception. Anytime we talk about contraception, we think about female contraception, but to our male listeners, vasectomies, people are afraid of vasectomies. They haven't heard the word. They don't know what it means. They think it makes them less of a man, but it is a very effective form of birth control. And for the amount of sperm relative to the amount of eggs, if we think about maths and numbers, makes more sense for the man to do the birth controlling than the woman who is producing one egg and then the man who is giving millions of sperm. But again, these are my personal views as a body of one. I would like to say that to our listeners, but
I tell you, we have to have a discussion about male contribution to this whole sex education discussion. I think that's important. And generally speaking, again, sometimes I'm doing premarital counseling and I ask a question such as, when can a woman get pregnant? And sometimes, 90% of the times the man doesn't know, and 50% of the times the woman doesn't know either. So it is important, the importance of understanding the body and how the body functions. This is really very important. Somebody's asking a question. Should we teach sex? Let me read the question that the person is asking. Should parents educate both their boys and girls in regard to pregnancy?
Yes.
Yes.
Well, definitely.
Yes. So
a woman
yes,
can't get pregnant on her own, right?
Thank you. Thank you. And another thing, I think that it tells, like we were saying, about the way that society views pregnancy and women in general. And as a church, again, I think we have such a beautiful, beautiful opportunity for witness here because of how much Jesus has shown us in his life and in his practice and in his ministry, how he cares for women and for children and for people who historically have been disenfranchised. I think we really drop the ball when we don't take up his mantle and his ministry and stand up for people. So I think that when we have our boys and our young boys, it is imperative, it is important, it is essential as a parent for you to make your young boy aware of these things, because it is, unfortunately, as he moves around in the world will tell him what sex means and what manhood means. And lots of the times, unfortunately, these things are tied together and in ways that young boys don't even understand. And they find themselves fighting for things and fighting to defend concepts of manhood and so on that they got from whoever and whomsoever who has no education. But you have a great and divine, I think, responsibility to teach our young boys, this is what it means to be a man. And this is what your body parts are. And this is what they can do. And this is what God intends them to do. And this is what it means for you as a follower of Christ. And as a man, this is your example, which is Jesus Christ.
Most definitely. Can overuse of contraceptives impact one's ability to either become pregnant or to maintain a pregnancy?
I feel like I've been talking a lot. I think so.
Okay,
well,
let me take
a.
No, I'll take a shot at it. Okay.
Yeah.
So okay. remember when we're talking about contraception, we're talking about a myriad of different types. But most of the most common ones are the pills, right? And most of the times, if a woman takes the pills and she decides, okay, it's time now for me to have a child, I want to become pregnant now, then her body usually gets back to normal quite easily, right? So it's different from woman to woman, but in a matter of weeks, once she stopped taking the pills, she could start having her regular menses again. The exception is with the injection, what we call Depo-Provera, right, Dr. Henry? When we take the injection and the woman decides now that we want to get pregnant, my husband and I decide we want to get pregnant, then it takes a longer time for that woman to become pregnant, because that hormonal effect on the body would render her even up to 18 months. She can have a problem with her fertility and her menstrual cycle. So it depends on the type of contraception that the woman is using.
Yeah, exactly. I think that's also because when we talk about contraception, again, there's two big categories, well, a couple more, but hormones and no hormones. And so,
right.
And even within each of those groups, it depends on the method. We mentioned the Depo-Provera, the shot, but there's other methods like the implant that goes in your arm, the Nexplanon.
Right.
If you take a Nexplanon out, so when I'm in clinic and remove a woman's Nexplanon this morning, I tell her, you can be pregnant tonight, just so you know. Yes. So there is some, it depends on the method. And overall, there's overwhelmingly no long-term effects that we've seen in the data so far in terms of a woman's direct fertility. And there's some women who have different health conditions and they're on, let's say, other medication that affects the efficacy or the usefulness or the way that birth control works. So if you're listening and trying to think about your own self, I would say that the first place you need to start is your own doctor that knows your personal history, and not just take it and go and say, oh, nothing will happen to me. I think you should definitely consult your own physician so that you can have a detailed, personalized conversation about you. But overall, no, birth control, as we think about it and as we know it, it does not affect your ability long-term to become pregnant.
Well, ladies, unfortunately, our time has expired. We have a myriad of other questions, but we have to stop now. So another time, I would be delighted to have you back to talk about especially the male contribution to all of this. Next week, we're going to be having a very interesting discussion on Let's Talk. It's going to be a totally different topic altogether. We're going to be talking about fanaticism. And I really want to urge all of you to give attention. Next week, we're going to be having Dr. Clifford Goldstein. He's a renowned theologian and a very avid writer in the Seventh Adventist Church. That has done a lot of research on issues relating to what we're going to be discussing next week. So we want to encourage you to join us, but our time has expired. We have to stay here now. I wanted to say my sincere thanks to both of you, Dr. Stevens, Dr. Henry, for the amazing time we have had discussing this topic. Like I said, there are a number of questions that are still I didn't get to, but that's it. Again, to our viewers, please remember we are begging you to subscribe. That way you'd be able to enjoy making your comments and chatting. We appreciate you cooperating with us, whether you're watching on SLC Church channel or on SLC Adventist. Please subscribe before you go. Doc, I want to give you 10 seconds each to share a last comment. Let's go. Dr. Stevens, 10 seconds.
Our bodies are the temple of God, and we should treat as such. I know at this age, we think that having sex out of, when you're married, waiting until you're married to have sex can be outdated, but we need to treat our bodies the way God wants us to treat it.
Amen. Dr. Henry?
Yeah, I think I just echo that with my closing remarks, that we whole ramifications and the way that we think about this entire issue of sex, sexuality, pregnancy, abortion, it starts with who you are as a created being and getting back to who God wants you to be and the vision that He has for your life. So seek Him and get closer to Him, and He actually will help you navigate these issues. So I think I'd like to invite us all to do that.
Thank you so much. Thanks to all of you. We'll be back next week with another very interesting and inspiring discussion.